talking about access to care, access to medication, let me break it down for just a moment into 3 different categories. The first is for the manufacturer. One is for them to understand the actual process of disease treatment, who's the prescriber, who's actually the treating physician, and then to also understand what the payer response is going to be, what has it been in the past, what they believe it's going to be in the future, and to design programs that deliver value in that environment. When we move into the physician, it's understanding barriers that that physician will face. So if you look at a prior auth and appeal process, physicians are not reimbursed in the practice for delivering a prior auth and appeal. And so if a manufacturer's program can deliver value in that area, that will help eliminate the process, the time to getting approval on a medication, and it relieves the burden of that overhead cost. When you move into a patient, it's beginning to understand currently, is there an out-of-pocket expense for them under these different benefit structures? Is there travel expense in order to get in to see the physician? What level of indication are they at this particular time for your drug? So if you're 3rd or 4th line, those patients have usually met out-of-pocket expense, maybe or maybe not have applied for government programs and assistance. And so again, it's taking a step back and looking at the full picture and the barriers to care that may be occurring. So in looking at patient assistance programs and the opportunity that brings both to manufacturers, providers, and patients. To begin with, for the manufacturer, it's an opportunity to actually move market share. When you're looking at barriers to care, especially during an early launch time frame, when you may be going out with a temporary code or not be loaded on formularies, there's an opportunity to use free drug to get that process started in introducing the drug to the market. Second, when you're looking at a provider, it's an opportunity for the provider to go ahead and get the patient started on drug as quickly as possible and work through the prior auth and the appeal process following. And then for the patient, it's that ease of mind knowing that they are not sitting out there with a diagnosis and then waiting for a drug to be approved. They can start on treatment right away, and that whole mindset changes that they're ready for the fight and moving forward.